Hello everyone, welcome to this special discussion. Today we have with us Dr. Shafiq Ahmed, a renowned urologist, uro-oncologist and robotic kidney transplant surgeon from BLK Hospital. Dr. Ahmed has over 18 years of experience, has performed more than 50,000 urological procedures and specializes in robotic kidney transplants.
Thank you very much. Thanks. It's a pleasure.
So, Dr. Kidney disease is often called a silent killer because it shows no symptoms in the early stages. Today, we'll talk about how to protect your kidneys, risk factors, early detection, and available treatment. Let's get started.
Yes, you rightly pointed out that kidney diseases are very much silent in the early phases. Human body has a huge tendency to pull out the things even when there are certain things already going wrong. And unless until we really do a health check and regular health screening, we may miss many things and the disease may go advance. So is the true holds for the kidney diseases as well. The kidney diseases usually are rampant in individuals who have diabetes, hypertension, recurrent urinary tract infection, recurrent urinary stone formation, congenital formations in the childhood, or there are certain autoimmune diseases which can affect the kidneys and lead to morbidity and mortality. So it's very important for us to always screen your body, pick up the silent diseases well on time so that we should not suffer as
So, Doctor, I'm stopping you, I'm sorry, but what is the basic for kidney health? Why it is so crucial?
Now, kidney is the most important organ like liver and heart in our body because the function of the kidney is to excrete all the toxins from our body through the urine. It filters the blood. It takes out all the toxins out of the blood and excrete in the urine. It maintains our blood pressure. It also produces our blood in forms of the hemoglobin and all other metabolism of the vitamins. So overall, this is the most important organ by which whole water of the body and the blood is being regulated. That means the whole homeostasis of the body is regulated by the kidney. So hence, it's very important organ, and any disease which is affecting the kidney means it will affect the whole kidney, whole body.
So, Doctor, as you have already mentioned in the starting, that kidney disease progresses silently. And at what stage do most patients come to you? And what challenges you face at the later stages when patient comes?
See, when we say that kidney diseases are silent, what exactly we mean by this statement? Majority of the kidney diseases means that we have a chronic kidney disease. That's where we label. It has a huge tendency, even if somebody say, for example, there's one marker of the kidney which we call as a creatinine test. Even if the patient is having a creatinine of 3 or 2, he may not be feeling any problem in his body unless until you have done a blood test which has picked up the creatinine level is high. Another thing is that you may be losing lot of proteins, lot of sugar in your urine. You may not be even aware of that also. You may be silently having an anemia. You may be silently having excessive fatigue. You may still not be aware that you are having a kidney disease. That's why we call it as a silent, the diseases are mostly silent unless until you are being evaluated by a physician. In my clinical practice, in my clinical practice, we receive, responding to your question, we receive majority of the patients who are really not aware about that they are suffering from the kidney diseases. So that's why it is mostly the silent. And we find that always the patients who are having a chronic kidney disease, they reach to us and at least stage 2 and stage 3. Unfortunately, few of them may also come in stage 4 or 5, which we call as a end stage renal disease. And at that time, no medical management or treatment is possible except, doing a renal replacement therapy.
So, doctor, we have also heard about people taking painkillers for headache and body pain. How harmful is regular painkiller use?
This is very important. Any drug intake without a prescribed prescription by a physician can be harmful to the body. Be it antibiotics, be it excessive vitamin or supplement intake, but particularly the painkillers are harmful for the kidneys. They damages the tubules and they can lead to the kidney failures. So many times the people who are sportsmen or who are sometimes the people are suffering from joint pains, back pains, some chronic headaches. They can be any sort of headaches like migraine, tension headaches. People just over the counter pick up the painkillers and start taking it. Do not consult a proper physician and evaluate what exactly is the reason. And they keep on taking for to get the relief of the pain. Ultimately, the end result that they end up with the damage to the kidneys. So, of course, there's always signs, warning signs for the people who are taking these painkillers. I would like to mention here one more thing, that two things. One is smoking, and another is alcohol. Excessive of both the things can lead to the kidney failures because they actually reduces the blood supply towards the kidney, which are harmful for the long term. These are the patients who can always have a problem.
So since you've already mentioned patients suffering with diabetes and high blood pressure, they are at major risk. So how can these people protect themselves?
See, these are the two chronic diseases which are the most common. Probably the highest number of attendance in any physician's OPD would be the people who are having a chronic high blood pressure or diabetes, type 2 diabetes mellitus. We know that there is no permanent solution to these two problems, and we know at the same time that these are the actual silent killers. When we say that the silent kidney diseases, of course, these are the main reasons which remain silent. So again, it is very important that anybody who is having any high risk factor, that they can have a diabetes or hypertension in their family members, anybody is having a hypertension, history of hypertension, high blood pressure, or a history of diabetes mellitus in their family, they should get themselves check the blood pressure and look for the blood sugars to diagnose whether they are actually silently suffering from the high blood pressure or high blood sugar. So we must, early detection is the key. The second thing is, if someone who is already having diabetes or already having a blood pressure. So let's talk about the diabetes. Now we know that the medications always keep your blood sugar in control. But as a patient, it is your duty also to keep your diet in your control, your weight in your control. You have to exercise regularly, and you have to consult your physician. You have to check your body so that if there any damage which is happening, should be taken care well on time. The biggest mantra to avoid the kidney damage for the patients who are having high blood pressure and the high blood sugar is to keep these two things in check. Follow your advice, dietary advice, follow your medication, get a regular health checkup to deal with any untoward complications or any untoward problems in any target organ. Be it's a kidney, be it your eyes also. Like diabetes may affect your eyes, it may affect your heart also, it may affect your feet also, because it can lead to the peripheral neuropathy. So this disease, diabetes itself is something which you need to take it as a holistic approach to prevent the target organ damage. Kidney is one of them, which is.
Thank you so much for such a detailed explanation. So, doctor, what are those routine tests that one can do to detect kidney problems early?
See, normally I always advise wherever I go in any public health awareness programs. So I always say that if you are suffering from any disease, then follow the routine protocol of your doctor, whatever he has, prescribed for you, whether it is after 3 months, whether it is after 6 months or 1 year. However, I think this is a message for more for the general public to hear that if you are able to do a service for your car in once, at least in 1 year, do check up for your body every year, because you may pick up so many silent problems which you are not aware of at all. So it will make a lot of difference for your health in the future. So the important test which we do to detect any kidney disease, as your question was, that there is a simple urine routine analysis will detect whether you are losing the proteins in the urine or not. See, it's very simple. There is a very simple blood test called a kidney function test, which will tell us what is your urea level, what is your creatinine level, what is your potassium level, what is your sodium level. There's a very simple ultrasound test to check what is the size of your kidneys. Is there any stone in your kidneys? Is there any swelling in your kidneys? So, if we find any problem in these tests, then we can always have some advanced analysis to detect what exactly the stage and level of your problem. Now, the people who are at high risk of having a kidney issues are people who are suffering from diabetes, people who are suffering from hypertension, people who are suffering from recurrent urinary tract infection, the children who are born with some congenital anomalies, are the families who had some autoimmune processes like SLE is one thing, or there are many other streptococcal. It was very common infection in the early phase of our country also. Because of the poor hygiene, people used to get a streptococcal glomerulonephritis. So all these things are there. Then if you know what exactly is the etiology, then you exactly evaluate a patient accordingly. Let's say, for example, a patient who is having a diabetes, we know that he is at a high risk of developing the kidney problem. We do for him, we always check his blood sugars, we always check his 3 monthly glycosylated hemoglobin, and we always advise them to keep his blood sugar in check. We always look whether there is any protein loss happening in the urine or not, how much is the sugar glucose which is losing from the body, and then of course evaluate these patients. So holds the true for the patients who are having a high blood pressure. So accordingly, for a general population, these are very simple few tests which I mentioned: urine test, one simple blood test KFT, one simple ultrasound will actually pick up the problem. For people who are already suffering from certain diseases, for them there is definitely some special test. He should consult his doctor.
Thank you so much, doctor. And another important question is, can the kidney disease be reversed if caught early?
Anything damage to the kidneys at a very early stages due to any autoimmune injury or any infection can definitely be reversed. I will repeat, any kidney injury at an early stage, which we even refer to as an acute kidney injury, due to inflammatory process, it can be autoimmune or any infection, it could be any bacteria, it could be any fungal, it could be any virus. These injuries can be reversed by certain medications. They are very specialized medication. We can reverse. However, if we could not pick up these injuries well on time, then these processes lead to the fibrosis or chronicity into this process. The body, whenever it is challenged with any foreign material, we call it as an injury or antigen presentation. It reacts by producing certain antibodies to fight that process. Now, initial process, sometimes this this antibody process by the kidneys can be reversed by giving certain medications, special medication. However, if this is not picked up well on time, it can lead to the chronic process, which we call as a fibrosis, which is not reversible. So, in short, if I say that some part, around 30 to 33% of the problems can be reversed if they are picked up well on time. However, rest of the problems, like the people who are suffering from kidney disease due to diabetes, the people who are suffering from kidney disease due to the hypertension, those processes cannot be reversed. But we can always delay the process. We can always delay the process of leading to the failure. The chronic kidney disease has stages: stage 1, stage 2, stage 3, stage 4, stage 5. So if we catch in stage 1, the progression to stage 3, stage 4 can be halted, can be stabilized because of with the help of medication. Reversal, as I said, it's possible at in some cases, but not in the all cases.
Not on all cases, yes. Thank you so much. We also know that you specialize in robotic kidney transplant. So, how does robotic surgery improve kidney transplant outcomes?
Yeah, so the surgery per se traditionally were being done from centuries now with an open technique. We know that even the robotic surgery, behind the robot, it is a surgeon who is doing the surgery. And the minimally invasive surgery has really improved with respect to many folds, be it a blood loss, be it infections, be it a cosmetic outcomes. But when we talk about the transplant, these are not the aim of taking to the robotics. The main aim in transplant is that these patients are very, very fragile, and these patients are highly susceptible to catching infection after the major surgery. So if we can avoid those infections, we can almost say losing 5 to 10% of patients due to the infections. So this is a major chunk. Unfortunately, the open surgery has big cuts. Lot of there's a significant amount of blood loss during these procedures, which leads to further down their immunities and exposes them to the infections. If we do these transplant by robot, all these problems are mitigated and they are avoided. The second most important thing is that this kidney, when we place in the abdomen, we put it into the pelvis. The pelvis is a narrow space. Here, working in the pelvis deep inside is always a challenge. In obviously, of course, in obese and fatty people, it's extremely difficult. May not be that difficult in the thin and lean patients, but working in the pelvis is always a challenge for the surgeons. So this challenge has been overcome by the robot. It becomes very easy with the help of the robot. Another most important thing is that when we are joining the small blood vessels, the lumen of vessels are actually 2 millimeter, 3 millimeter. And with the human naked eye, sometimes it is difficult. Although the vascular surgeon, being we are the vascular surgeon, when we do the kidney transplant, we definitely use certain special loops to augment our vision so that the structure of the vessel looks quite bigger. So this robotic magnification is 10 times. That means the 1 millimeter vessel will look like a 10 millimeter. So when you are joining it, they are joined with great accuracy. And the outcome of the transplant is far better in experienced hands when it comes to the overall outcome. In addition to that, there are very specific complications which are there with the open transplant. The one I will mention here is a lymphocele formation. If I make it easier, lymphocele means that the water collection around the kidney. So this happens mostly after at least 4 to 5 weeks after kidney transplant sometimes. And this complication is only with the open transplant which is absolutely zero with the robotic kidney transplant. So there are many advantages, barring one that it is, of course, is not a cost-effective procedure. There is some cost involved in this. Barring this one drawback, I would say that this is robotic kidney transplant is going to be the gold standard over open kidney transplant in the future as well.
So we basically can say that the outcomes are much better comparing the traditional transplant method.
If we do not say they are better, but if they are not even inferior when it comes to the outcome. When we say outcome, means that whatever kidney we use, that our main objective of giving a normal kidney function to the patient is achieved. When we say compare with the traditional transplant, it is at par with the traditional transplant. But look, we are getting so many added advantages in addition, which is not there with the open kidney transplant. So I mentioned the biggest challenge after any kidney transplant is dealing with wound infections and saving those patients, because these patients are immunocompromised. God forbid, if there is any infection, it's very difficult then to save these patients. So if we really look into those perspective, even what I mentioned, that the cost is one factor, I would say even that cost can always be ignored when we really compare advantages and disadvantages, open versus robotic kidney transplant. I would say robotic kidney transplant, of course, is the best choice.
So doctor, as we wrap up, what is your key message for the viewers, especially I think the young viewers?
I was speaking somewhere, so we all know, in fact, the people have so much rampant information on the fingertips nowadays, that the most common diseases which can lead to the kidney diseases is diabetes, hypertension, some glomerulonephritis, autoimmune diseases, congenital problems, recurrent urine infections, stones, and the drug addiction in individuals, younger individuals, or anybody, like be it a painkillers, any other prohibited drugs, can lead to the kidney damage. But I mentioned one very important message at that time, that having a proper nutrition for mother and child. When the child is in the womb of the mother, our all organs, whether kidney, heart, liver, brain, it develops there. We have to look as an Indian on the rural India, all across the country, whether we are having our birth weight of our children is normal or they are the low birth weight. Look, the kidney will start having a problem right from the womb of the mother. So if we had to pass on a message now today, that we as a nation has to have a healthy baby, healthy mother, to prevent these kidney problems in the future. Of course, people who can afford can get their health checkup to detect early diabetes, to detect early hypertension. Why not we can have those programs to have our children born with a good weight, our mothers who can breastfeed their children with a good health, can produce the healthy children. Of course, that would be a healthy nation as well.
Thank you, doctor, for such a valuable insight. That's all for today's session. If you have any questions, drop them in the comments. Don't forget to like, share, and subscribe to spread awareness about kidney health. Take care.